Hello, Pain Free for Life members, and welcome back to another Monday 10-minute training. I don't know how many of these I've done. This is our video series where I try and admittedly sometimes fail to teach a microcurrent concept in under 10 minutes. So today, by popular demand, we're going to be talking about a topic that I openly claim to be no expert in, which is oral care support. So we're talking about cavities and more. So while I am not a dentist, I have been surprised and initially confused by the sheer amount of microcurrent users who've asked me to help with dental issues. And I've obliged with suggestions over the years that have proven to be highly effective. I don't know why this surprised me as much as it did, because the original microcurrent equipment we used to use had a dental attachment to it. And I know from talking to John, talking to other doctors, that there are dentists out there that do use microcurrent and do even recommend microcurrent for dental issues. But as an area of specialty, the teeth are a completely different beast to the rest of our body. So whether it's cavitations, whether it's infections or damaged roots or tissue, there appears to be something that microcurrent can do to help. Now, this being said, I want to preface that I have not seen anything dental be an overnight fix, barring like a basic toothache. Typically, people who are looking at a few months of treatment here, if you want to get the success, if you're really looking for success in your dental issues, you're looking at a couple of months to be able to make that work. And this is daily treatment here. So let's cover a few of the basics. So this is going to seem complicated, but we'll break it all down. So first, number one is nerves. So nerves, or the root of your teeth, these respond best to 2 hertz. So 2, not very high at all. This can be accessed in AVA mode in the Pinnacle or the Pro Sport modes. And technically, you could also use Sana Bio 2 in the Pinnacle for the specific treatment of nerves. But in the case of teeth, I think I would recommend focusing on the 2 hertz programmed in. You don't need the swing of the ultra high frequencies that we often need for most nerve damage when you're dealing with teeth. So in the absence of the Pinnacle or the Pro Sport device, a device like the Life Evolution can use 7 to 12 hertz to great effect here. The next thing would be soft tissue. So soft tissue therapies can be done at 90 hertz or 77 hertz with a preference on 90 hertz. This here, 90 hertz, this makes Sana Soft T the king frequency here. But 77 hertz can fill in nicely when dealing with soft tissue damage. Next, we got scar tissue. So as always, scarring should be dealt with as a priority. And the only way to do this is 77 hertz. Any dental procedure, such as a root canal or extraction, will cause the creation of scar tissue. And this program will neutralize this scar tissue, which is not only blocking healing and creating pain, but it's also causing interference in the meridian systems. And that is going to impact overall health. So next we have bone. If you're dealing with cavities, this is the program you're going to want to use, okay? Sana Bio 7, AVA 7 hertz, 7 to 12 hertz. These are all great options to access the key 7 hertz frequency that can trigger repair in bone-like substance in the body. The next thing is inflammation and pain. We can't do anything if we are inflamed. Nothing above is going to work the same if we don't take care of inflammation first. So go right for any program above 100 hertz, 350 hertz, 121 hertz, modulate, Sana pain. In fact, realistically, any of the Sana modes are going to have anti-inflammatory modes built in. And then the next step, well, it's not, these aren't even in step order. I'll get to that in a moment. These are just things we need to be concerned about, is circulation. Improved circulation is for fighting infections, but also for healing tissue. All microcurrent frequencies do this, but Sana IP, Vaso, FMRSI, these are among the strongest choices for this. Okay, so halfway through the video and I made it through that. So those are the basics, but what's the actual protocol? Now, this is going to differ depending on exactly what oral issue you are trying to deal with. So, first, let's number one, always start with scar tissue. If you've had a dental procedure before, if you've damaged a tooth, if you had an infection, there's the potential that there's going to be scarring. So, treat the scar directly, either through the tissue on the face, so you can take the device and you can apply it directly to the area where, like, if the tooth's on the other side, right? Apply it directly there. You can use the Y probe for this as well. It's totally fine. You should feel it in your gums and your teeth going through your face. Or my preference is the tongue stimulator. This tool can go in the mouth. You can get it right in there, and you can have it positioned in the right positions on the gums and exactly the right spot to deliver those frequencies. So, next step, after you've dealt with the scar tissue, remember you don't have to go back and deal with it again. That's the beauty of that. Step one is done once and done. So, step two is to reduce inflammation. Always take this step. It doesn't matter if you've treated it 10 times before or for 10 days in a row. Make sure you take a few minutes, because reducing inflammation enables healing to occur. Even if it doesn't hurt, it's possible there's some inflammation there. So just do 2 to 3 minutes or so of an anti-inflammatory mode, and make sure you just treat, again, directly on the area or use the tongue stimulator. Keep in mind that if you're using like Sana IP or Sana Bio 7, you're automatically doing anti-inflammatory in your treatment. The next step is to improve circulation. So, how many times have I said this, guys? Blood is life. I've made quite a few videos talking about the importance of circulation for optimal health. This is an important healing step. So, after you've reduced your inflammation, spend 2 to 3 minutes improving the circulation in the body with your mode of choice. And then lastly, step 4, we're going to heal the tissue. So, what are you looking to heal? Soft tissue, bone, nerves. Pick your tissue type. Use this program for 2 to 3 minutes. It's pretty easy. You got to do your scars first, at least once, reduce inflammation, improve circulation, regenerate tissue. So, if you need to do nerves, you go back to 2 hertz, right? Like we talked about earlier in the video. If you need to do bones, you do 7 hertz, and so on. So remember that, again, aside from this scar tissue therapy, the entire protocol would be covered under something like Sana Bio 7 if you have the Pinnacle, if you're looking to heal bone. So there's no need to do the rest. The Sana modes do anti-inflammatory, they bring in circulation, and they trigger regeneration. So aside from the scar tissue, that's all automated for you. In all cases of what I mentioned above, I actually prefer the use of the tongue stimulator directly on the gums, but you can treat through the cheek as well. If that's more comfortable for you, or if you just don't have the tongue stimulator and you don't want to get it. But I think that the most direct we can be is going to provide more, greater effect for us. The other thing I should mention is if you have a Hache, I have heard amazing things about it and how it works to improve all of the above treatments. In many of the cases that I've read, and these are like testimonials, reading people talking about their dental recovery journey, in many of them, people mention that the Hache has been something that they felt swung the treatments in their favor, like dramatically. So, high recommendation coming in there as well. And of course, the Hache is just used with 7 to 12 hertz, pointing at the area before you do any of the other treatments. Okay, so that is a lot to unpack, but this video will be here on Facebook. It's going to be uploaded to YouTube as a replay, so you can rewatch it and you can take notes. I hope this helps those of you looking for oral care tips. If you have any questions, drop them in the comments below. Otherwise, I hope to see you next week for another Monday 10-minute training.